The rollout of Obamacare is, of course, in deep trouble. There is another problem, however, that could be far more serious than even the healthcare.gov disaster threatening the program. 20 states and the District of Columbia have announced they're participating in the Affordable Care Act's expansion of Medicaid. For the Affordable Care Act, though, to actually work, it has to be, of course, affordable. As of right now, it's not. More people are enrolling in Medicaid than buying Obamacare insurance. In Washington state, 87% of the newly enrolled on the health insurance exchanges signing up for Medicaid. In Kentucky, 82% taking Medicaid. In New York, 64% choosing Medicaid. Now, it shouldn't surprise anyone, least of all the Obama administration, that people are choosing free over relatively expensive, that people are choosing Medicaid over private insurance. Joining us now to assess what is happening here, columnist, Fox News contributor Ellis Henican. Good to see you, Ellis. And radio talk show host, Fox News contributor David Webb. David.
Good to see you.
And editor-publisher of ConservativeBlackChick.com, one of the all-time URLs, Crystal Wright. Great to have you with us. Let's start. Were you shocked at this report first, that there are 108 million Americans right now on means-tested welfare, and that at the same time as the launch of Obamacare is underway, the newly enrolled are enrolling in Medicaid, not Obamacare?
You want me to go, Lou?
Yeah, that's why I said Crystal.
Okay. Well, you know, I'm not surprised. From day one, President Obama has said he's going to transform America. He's kept pushing the entitlement state down our throats. He doesn't want us to work anymore. So I'm not surprised. I mean, Lou, look, if I could get some free stuff from the government, I'd probably try to do it too. But I'm considered the rich, because I actually work for my money. I mean, I'm not rich, but I'm a higher earner, I guess, in Obama's, mindset. So I'm not shocked, but I think what's going to be a shock for the American people and Democrats is when Medicaid balloons in cost, because we know that's going to happen, because I think in 2015, isn't that when the government backs out and they don't pay 100% of the Medicaid tab under Obamacare?
What Crystal's referring to is 2015, then the states began upping the ante, the portion that they will be paying of Medicaid. Ellis, your reaction to what's going on here? We're on day 24 of Obamacare. The promised land has arrived. The promises are not being kept.
Well, Lou, by my count, it's 5 months and 6 days until the sign-up deadline comes. And you're right, it's frustrating. The bugs in the computer are a problem, and it's hard to get on there. We've all been pulling our hair out about it. I'm not yet at the panic point. I do think that 5 months and 6 days is probably long enough for folks to get this done.
Least of all me. So you're not concerned?
Well, no, I'm absolutely concerned, and I like the fact that the White House is on it, that they got some smart people, I think, doing it, and if they don't get it done in a month or two, I really think there's something to worry about. Now, but people are using this as an excuse to undermine something they don't like in the first place, aren't they?
I see. David, let me ask you this, because Ellis is right. He projects forward to March 31st, the new deadline for enrollment here. But the real time span is 3.5 years previous to the launch of Obamacare through the 24th day of October. That's how long it took to ramp this thing up. It's an abysmal failure. What makes anyone think we're going to see any better when we get beyond the website?
They didn't even get to the ramp. What ramp up? They've had 3.5 years. They've had 4 to 6 days of testing. They did very little load testing. The phone system wasn't even tested. This was a giant $680 million plus boondoggle. And what we really have to work on is how we fix the structure. Because I go to the people who want to use Obamacare. How are you going to get what you were promised? This is a skyscraper with a lousy foundation.
At least some of them are they're finding it over with Medicaid.